Depression and anxiety continue to climb. Many people suffer in silence.
Our next pandemic may be a mental health pandemic.
We know that isolation and loneliness can exacerbate existing conditions.
All of us should be planning as if we were planning for a pandemic.
Kids can't go to school, or at least in some places. Many people are losing their jobs.
It's a challenge that's stressing a lot of us out.
And so much help is available. You can see all of the avenues there for you.
The world needs to know that mental health matters and that it's just as important as physical health.
You know, some days she can't get out of bed, she can't keep a job.
You know, even before a pandemic, there were long wait lists for mental health services among youth.
We get silence to shame trying to meet people where they're at.
Speak on it. Silence the shame.
Good morning, everyone, and welcome to the Atlanta Press Club. My name is Christy York-Wooten. I'm president of the club. Thank you for joining us today for our PBA Conversation Series event, The Mental Health Moment, COVID-19 and the Next Pandemic. Today's event explores the effects of the pandemic on mental health and is produced in partnership with the Carter Center. This presentation is brought to you in part by the AIDS Healthcare Foundation. So we all know mental health is in the news, and we are seeing more and more high-profile people such as Oprah, Prince Harry, Atlanta Falcons, Hayden Hurst, and others talk publicly about the subject as we in America navigate our way through another transitional phase of the COVID-19 pandemic. We have convened a fantastic all-women panel of experts today to discuss the issues. Today, our program will kick off with remarks by CDC Director Dr. Rochelle Walensky, and will also include a tribute later on to former First Lady Rosalind Carter, who has worked tirelessly to end the stigma around mental health. First of all, today, we want to welcome our moderator. Before we hear from Dr. Walensky, Karen Greer. She is an anchor at CBS 46 Atlanta, a past president of the Atlanta Press Club, a member of our board, and also serves on the board of governors for the National Academy of Television Arts and Sciences. Karen is a 6-time Southeast Emmy winner. Please welcome Karen Greer.
Thank you so much. So excited to be here with you on this Friday as we discuss some of the issues that really are affecting us in our community. We hear about mental health. We talk about it a lot in the news. We heard a couple of weeks ago from tennis Grand Slam champ Naomi Osaka discussing her issues with mental health as well. So we know it's in the headlines, and we know folks are struggling with anxiety and depression in the wake of this COVID pandemic. And, you know, the mental health crisis has just disproportionately affected members in the Black, brown communities, communities of color, and many young people are also experiencing a decline in mental health and well-being. So we want to discuss today for this next hour, these topics more with our panelists, some experts in the field. But first, we do want to hear from Atlanta-based CDC Director, Dr. Rochelle Walensky.
Forum. The most recent forum introduced the unified vision for transforming mental health and substance use care as a roadmap for accelerating effective mental health as the nation struggles with the tragic and pervasive mental health impacts of COVID-19. Here in the United States, we have made great progress in the fight against COVID-19. And while I'm not yet ready to declare victory, I'm cautiously optimistic we are on the path to a more normal world, or shall I say, an even better normal world. As each week passes, the decreases in cases, hospitalizations, and deaths give me hope. As we do the hard work of vaccinating the entire country one by one, we are helping people make informed decisions about vaccinations. And we are working with public health leaders to make data-driven policies about how to safely get back to the activities we lost during the pandemic. Still, we know that as the pandemic has progressed over months, behavioral health, mental health, and substance use issues have increased. COVID-19 not only exposed old cracks in our public health infrastructure, it intensified a broad range of factors that drive disparities in mental health and emotional well-being, including food and housing insecurity, coping with loss, and racial and ethnic disparities. The greatest burden has been carried by those who are already struggling. We also know that the pandemic has taken an enormous toll on our youth. A CDC study published last summer in the Morbidity and Mortality Weekly Report found that younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers reported disproportionately worse mental health outcomes, increased substance use, and elevated suicidal ideation during the pandemic. Another study recently published in JAMA Pediatrics found a staggering number of children, an estimated 37 to 43,000, were left orphaned by the COVID-19 pandemic, with Black children disproportionately affected. Tragically, the impact of those deaths will be felt for years to come. I find these data extremely concerning, both as a mother and as a physician. I can tell you that CDC is working hard to support children and their families on a number of fronts. We know what young people need to help them move forward. They need knowledge and skills, access to services, and strong connection to family, peers, and schools, often referred to as connectedness, to soften the blow of how much trauma they have experienced. We are addressing the mental health effects of isolation and remote schooling. I have said from the very beginning of my move to CDC that science and data would always lead the way, and those data confirm that we have the tools necessary to get our children back to in-person instruction safely, equitably, and fully in the year ahead. And of course, it's not just the children that we must consider. Millions of healthcare personnel responding on the front line have also felt this pressure. A surge of new cases of depression, anxiety, and insomnia, plus worsening of existing mental health issues, particularly among nurses, has been attributed to limited resources, overwhelming workload, longer shifts, disruption to sleep and work-life balance, process inefficiencies, occupational hazards, and concerns about health and financial stability. I saw these, lived these firsthand with my own healthcare workers, my colleagues and dear friends at Massachusetts General Hospital. President Biden and all of the Department of Health and Human Services understand the need and are working vigorously to make behavioral health services available and accessible. We are making a $3 billion investment in mental health and substance use block grants, the largest aggregate amount of funding to date, and establishing a new HHS Behavioral Health Coordinating Council to address the nation's behavioral health needs. And I am truly honored to be co-chairing the Council's subcommittee on suicide prevention. I want to thank the Carter Center and each of you for all you are doing to help America get back on her feet. We are all in this together, and together, connected to each other, we can see our way out of it. I know the work you are doing will help lead the way. Thank you.
Thank you, Dr. Walensky. We really appreciate your time making these remarks. She's going to be very busy today. We understand she's going to be with the Vice President, Kamala Harris, at Ebenezer Baptist Church, trying to encourage more people in the community to get COVID-19 vaccines. That's something the President has asked to be ramped up and fully operational by the 4th of July. So we know she's going to be very busy today. And on this, now the eve of Juneteenth, which is now a federal holiday, this is even more important for us to discuss this because, as she mentioned, it is affecting members of the minority communities of color, more than any other community. So we thank her for those remarks. And we are going to now introduce our fabulous panel of women. We're going to begin with Dr. Eve Bird, Director of the Mental Health Program at the Carter Center. Thank you so much for joining us. Shanti Das, former music industry executive, mental health advocate, and founder of Silence the Shame. Stephanie Fu, award-winning radio producer and journalist for This American Life and the New York Times. And Dr. Deborah Howery, Director of the Centers for Disease Control and Prevention's National Center for Injury Prevention and Control. Thank you so much for joining us, all of you. We want to get right into some of the questions, and we're going to begin, Stephanie, with you. While you were a mental health journalism fellow at the Carter Center, you wrote a piece for Vox about post-traumatic stress disorder, or PTSD, which you called your superpower in the wake of the pandemic. Now you've got a book coming out next year about your experiences. So can you talk to us about writing about PTSD and explain how this pandemic actually affected you and your work?
Sure, yeah. I think that the remarks that we just listened to, especially around mental health providers, probably resonated with a lot of us as journalists. I know that viewing suffering on such an enormous scale can be really, really difficult. And in 2018, 2018, after a couple of hard years of reporting on racism and the Trump administration, I just had a complete sort of breakdown at work, and I wound up needing to quit my job. And that led to a diagnosis of complex PTSD, and really reckoning with the fact that I had endured a lot of violence as a child, and seeing violence committed against other people of color on like a daily basis was extremely triggering and difficult for me. And I think I took a lot of time in the next couple of years to really focus on my mental health and create healthy boundaries between myself and work. And so certainly all of that really helped. But I think that one thing that I really struggled with after that was this feeling of failure, was this feeling of, oh, my complex PTSD makes me broken, makes me not as effective a journalist, makes me less resilient. And then when the pandemic happened, the conversations about mental health really came to the forefront. And all of my friends who I thought were really together, sane people, were posting on Instagram every day, like, I can't get out of bed, I'm eating all day, I just can't, I'm so depressed, I'm so sad. And for me, I actually felt way more functional, because this atmosphere of total fear is something that people, survivors of PTSD, deal with all the time. And we work through it. And I was kind of almost like, I'm used to this. And it felt, I mean, look, it wasn't Schadenfreude or anything, but I was kind of like, oh, now you know, now the whole world knows what it feels like. And that was so normalizing to me that it lifted this veil of shame that I had. And that shame, that stigma, I think really made my PTSD much worse. And without that pressure of shame, my PTSD actually became much more easy to deal with, made me much more high functioning, and made me be able to support others during the pandemic. And so I think it really illuminated for me the weight and the effect of shame and stigma, and how if we can work to show people that so many mental illnesses actually can be advantages, can be superpowers. Like for PTSD, for example, we always have understood that it makes us less functional, but that's not true with complex PTSD. Actually, in times of intense stress, our minds completely dissociate, which is not necessarily a bad thing, because if you're like, if somebody's coming at you with a knife, it's really good to completely dissociate, because you become hyperlogical, you can like function really well, you can kick ass. That's what I felt like during the pandemic. And if we can understand this upon diagnosis, and when they're diagnosing you, they can tell you like, look, you've got this thing, it may make you suffer, but guess what? You also have these secret advantages that make you kind of a badass. You know, that is, I think, would change our experience of mental illness a lot and alleviate the symptoms considerably.
So that's your superpowers that you speak of. We appreciate that. Sorry you had to go through that to experience what you have now. And, you know, you mentioned shame. Our next panelist talks about that. A dear friend who I know has dealt with this up close and personal, Shanti Das. Thanks for joining us. Now, you work with several celebrities, as we're hearing about celebrities coming forward, discussing how mental illness is affecting them. Do you think by them coming forward, sharing their stories, that can help others?
Thank you, Karen, and it's good to share this platform with you, my friend. I do agree with you. I think when celebrities and people of influence, right, whether they're actors or actresses or musicians or songwriters, influencers, that sort of thing, it certainly helps to eliminate some of the shame. One of the things that we've done probably since the inception of forming the movement Silence the Shame that turned into our nonprofit was to utilize celebrities to really help to normalize the conversation. In 2016, we did a soft launch with musician and TV personality Nick Cannon to start opening up the conversation. And since then, we've worked with artists such as Carrie Hilson, Common, Anthony Hamilton. Last year during the pandemic, it's interesting to hear Stephanie's testimony. We did see so many people talking about it on Instagram. I actually started a platform called Yeah Wellness. It was just like an IG Live talk show. And I talked to everyone from Erica Campbell to Chuck D to Swiss Beats, D Nice, the famous DJ now. And everybody, again, to Stephanie's point, was kind of having this sense of like, wow, okay, like I understand it, but I still think we have a long way to go. It's interesting, I get a lot of personal texts and private DMs from some of my former colleagues. I was an executive in the entertainment industry over 25 years. And I think people are still a little like nervous, like, hey, do you think you can possibly connect me with a clinician? I don't really want to talk about it much. And that's not to say everyone has to be on Instagram sharing their stories. You know, when you think about it, we are on the eve of Juneteenth, right? And folks in the Black community specifically, unfortunately, we've been taught to kind of don't share our secrets, right? And don't tell our thoughts and fears too much. We just want to project what's great or what we want the public to think is great in our lives, right? On Instagram, which I like to call the highlight reel. But I do think we all need to like have more really open and honest conversations and start right there in your homes. There's so many celebrations that are going to be going on. And food, I think, is certainly a big part of the celebration of Juneteenth. So when you're sitting around that table, let's have these conversations about our thoughts and our feelings. I coined this new acronym called RAP. Being able to unlock those unfamiliar feelings and be able to talk about it in a thoughtful and meaning way. So RAP, the R is for recognizing those feelings. The A is for acknowledging them, but then you got to accept it. Because how many times has something happened and we'll say, okay, that did happen. I don't really recognize that, but that's not me. I don't want to accept this. I'm going to ignore it and act like that didn't happen. But you got to accept it, and then you have to process through it. So as our influencers and celebrities continue to help normalize the conversation, we got to actually do the work. So it's wonderful that everyone's coming forward, but are you really taking that next step to find a therapist? That is why it is so important, right, to educate yourselves around resources that are available, which I know we're going to share before the end of the program. But you got to do the work. And for me, when I was going through my own suicidal ideation in 2015, I was terrified for any celebrities or influencers that I worked around. And I'll end with this quick little story. This was 3 years ago. I was in Los Angeles going to the Rock Nation brunch. And Rock Nation is a company that rapper and philanthropist Jay-Z owns. And so it's like the holy grail of events during the Grammy weekend. And I really hadn't been in front of my colleagues since I had gone through a lot of my own suicidal ideation and started this movement. And I was really terrified. I was embarrassed almost. And I had been doing the work, but there was still this level of fear for me to really go and share when people, because, there's always the small talk. How you doing? How you been? What you working on? And, oh, well, I thought about killing myself and taking my own life and had this grand idea of starting this little movement. But I prayed about it and I went in there and I said, I'm just going to own up, right? I'm going to continue to be transparent, continue to be vulnerable. I'm not going to hide behind who I was on Instagram. And those that love me and accept me will be okay. And went in, got to talk to Beyonce and Jay-Z. They were very thoughtful and caring and introduced me to one of their friends who was a psychiatrist that was attending the event. And it was like a breath of fresh air. So if anything, I want you all to take away the theme of just breathe through it, just be able to process through it, and yes, let's take some of the influences and empowerment that we get from our influencers, but let's also do the work, right? Because we can all talk about it, but you got to be about it. If you're going to talk the talk, you got to walk the walk. For me, I lost my sister 2 years ago. Grief has thrown me back into the throes of depression and anxiety. And then just opening back up. I went to several events this week. Now we're kind of post-pandemic, if you will. And I'll admit, I was really anxious driving. I was very nervous and I'm still a little apprehensive about confirming events in public. So let's really get the tools that we need. Once we learn about it, we got to do something about it. So that's kind of, my advice, even when I talk to a lot of the celebrities, like do the work. Don't be afraid to go to therapy, or don't even be afraid of medication, because that's a whole different panel of discussion. But some people are afraid to be on antidepressants, but some of us can't just snap back out of it. We do need medication and other healthy ways to cope. So let's normalize the conversation, but let's also get the help that we need.
Keeping it real, both of you. We appreciate that. Shanti, love you for that. Dr. Howery, you are next. Did you have something to say before I ask your question?
Oh, Dr. Bird. I just wanted to add, we are so appreciative of our celebrities and VIPs coming forward, because we know the stories are extraordinarily helpful. And why Mrs. Carter started the Journalism Fellowship Program to help journalists tell true and effective factual stories. And I just wanted to dovetail with Shanti's point about doing the work, but also it's really, at the end of the day, we're all humans, and it's that person-to-person contact that makes so much difference and instills hope in people who are having issues. Those that have had issues for years and it's been exacerbated by the pandemic, those that this is the first time that they've been struggling with some of these symptoms. And I just wanted to share, and particularly for our youth, who we heard early are very much affected by the pandemic, and astronomical portions, that peer-to-peer is so very important. And I just want people to be aware of the Free Your Feels campaign, which Voices for Georgia's Children and the Department of Behavioral Health and Developmental Disabilities. You can just Google Free Your Feels, wonderful toolkit. And the whole game there is to trying to get youth to begin to talk amongst themselves and support each other, because we know youth peers are the most important, but there's also really great information for parents and great information for teachers in the school community as well.
Great remarks. Dr. Howery, let's talk to you about, we heard the statistics mentioned by Dr. Walensky, incidences of depression, even suicidal ideation, as Shanti just talked about, are up, especially among young people. The Washington Post reported that ER visits for suspected suicide attempts among teenage girls actually rose during this pandemic. What can you tell us about those trends and how family members, which is most important, can help young people who may not show outward symptoms of mental illness or distress?
Great question. And I'm also an ER doc, so this is a very real to me from the front lines. I think what I would say is we've certainly seen an increase in suicidal ideations and suicidal attempts among young people. But I think it's important to take a step back and keep it in perspective. And in 2019, we saw the first decline in suicide deaths in the US in about over a decade. And our early data from 2020 are also showing a decrease in suicide deaths, including among youth. Certainly, there has been mental distress. And I think it's important, though, to realize that mental distress can result in more help seeking, which is exactly what we want. And there's been great studies that have shown after you contact the crisis line, the likelihood you'll die by suicide goes down. So although these numbers are showing increases in suicidal ideation, I'm hopeful in that people are then getting the services they need, and we won't see an increase in suicide deaths. We released a study, our first CDC vital signs ever on suicide a couple of years ago. And what we showed were people that died by suicide, more than half did not have a known mental health diagnosis. It was things like substance use, relationship issues, job loss, economic stressors that precipitated the death or led up to it as one of the contributing causes. Certainly mental health issues were part of that, but that's why with this pandemic, I worry about social isolation, some of the job stressors, some of the relationship issues, and the increase in substance use, because certainly that could lead to an increase in suicide deaths. But what can we do about it? I think both Stephanie and Shanti really hit on it. I think asking how people are feeling, connecting them, being there for them, and referring them as appropriate. And what Stephanie hit on too about trauma as a child, I think we don't talk about enough, but adverse childhood experiences and the trauma you have in childhood can result in increased rates of things like mental health issues or substance use. So it's so important during this pandemic that we focus on our kids now and make sure they have those safe, stable, nurturing relationships so that we can really provide those protective factors.
Awesome, thank you. And now Dr. Bird, talk to us about mental health and how it's actually been impacted during the pandemic, both on a local scale and on a global scale. The Carter Center Mental Health Program doing a lot of work both here in Georgia and in places like Liberia, West Africa. How does this approach in behavioral health differ globally, or does it at all differ?
No, I don't think that it differs. It differs in the fact that there are less services in low and middle income countries, and there's probably a greater amount of stigma as well, because not as much work to date has been done on that. However, what we can learn from our low income countries is that everybody doesn't have to see a psychiatrist or a psychologist, that you can put systems in place and supports in place, as I mentioned earlier, the Free Your Feels or the peer support services, teaching laypersons through mental health first aid, how to recognize signs and symptoms of mental illness, and how to direct somebody, how to have a conversation, support that individual, and direct them to the services that they need. And that may be just the beginning of having a conversation with a primary care provider and not necessarily a mental health specialist. We certainly don't have enough mental health specialists here in the country, nor do low and middle income countries have it. We never will. So it really depends on the full community to address this and be actively participate. Just as we teach people how to do first aid or CPR, stop the bleed, things like this. Really, if mental health first aid became a priority for our population, supports like certified peer support specialists, people that have lived experience and know how to navigate and are not encumbered by stigma any longer and can help navigate for someone else, we can do a lot more. And the pandemic is really shown us that we don't have the supports or the specialists that we need. So it really does need to be a public or a community health response.
Can I just add to that? And that is so important. Thank you for those words, Eve. Particularly, I know amongst people in the Black community and young adults, we're trying to really do a push to make sure that psychiatry and psychology are seen as viable career options, right? And so really being able to put those programs in place, we're excited that we're going to launch the Silence the Shame Campus Ambassador Program at HBCUs in the fall and larger universities. And then we're also going to launch our leadership programs, which will be probably 50 to 100 students, maybe at a couple of schools. We're going to pilot it. And we're going to teach leadership as well as mental wealth best practices, right? Because our leaders need to be equipped. We always hear people talking about, even in athletics and entertainment, that you got to be mentally tough. But what does that really mean? I still don't think that a lot of the mental coaches that you find in some of the larger universities and institutions are coming from a perspective of, clinical health, right? And so we want to be able to pour back into them, but really make sure that we do, moving forward, have more clinicians that look like us, because there's a thing called cultural.
Most definitely. Yes.
So that when licensed professionals are trained, they understand how to help communities of color, whether it's the African American community, the Asian American community, the Indian American community, and really being sensitive, right, to those cultural nuances that are able to help you once you do decide to get the help that you need. We want to make sure that we have the best of the best available and the brightest of the brightest in terms of clinicians, and especially in communities of color. So we certainly look to partner with any organizations that are looking to make sure that we can add to that 5%, if it is even 5% of clinicians of color that can really help our communities.
Really Ashanti, I'm gonna go back to you right now, because you have been so open in dealing with your issues and what actually brought you to realize that there perhaps was a problem. Can you talk about that? Share again. I know you've worked with Jack and Jill of America, kids that I know that you really helped them recognize some things that they may not have been aware of. But when it was for you, you were at the top of your game. Things were going great. Everybody knew Shanti by name, and you had, as you said, traveled everywhere, knew everybody. But what was it that brought you to the point where you realized there's a problem?
Thank you again for that. I am pretty much an open book now. I love to share my story. As mentioned, I had a great career in the entertainment industry. It was probably 2009. I was at the height of my career, making almost $500,000 a year and marketing some really great talent in our music community. And it was a lot of things, Karen. It wasn't just one thing. My mother developed dementia, which turned into full-blown Alzheimer's. I was literally riding in a taxi uptown in New York City one day, and my entire right side went numb. I was diagnosed with cervical spinal stenosis. I'm talking now, I'm in my mid to late 30s. This is something that most people get diagnosed with in their 60s and 70s, but it was a direct result of the stress that I was dealing with in the workplace. Self-care and wellness and mental health, just 11 years ago was not a part of our everyday vernacular and entertainment. We weren't talking about it. Our organization didn't have a partnership with Calm or Headspace or any apps to help us through it. And apps wasn't even a thing really back then, right? Social media was just starting. So it was tough for me. I didn't know how to channel all of that stress. And I literally was going into the office every day. And I told my assistant, don't call me unless it's my boss. I just had gotten to a point where I couldn't function at work. And so I quit and walked away and moved back home. And as Deborah mentioned, there are times where, suicidal ideation can come from not even just the regular depression, just the stress of everyday life. And so moving back home, starting over, my peers were still president of this, EVP of that. Here I am starting as an entrepreneur, trying to start over. That nest egg that I had went away. I almost lost my home in Alpharetta twice. And it was just a lot at one time. And then my best friend in 2014 took her own life, the exact same way that my dad did, from a gunshot wound to the head. And that sent me, Karen, into a downward spiral. Couldn't really figure out how to come out of it. And it was my sister who encouraged me, again, going back to something Deborah said, I did call the National Suicide Prevention Lifeline, which is 1-800-273-TALK. That encouraged me to get the help that I needed. Also, that same evening, because I'm a member of Ebenezer Baptist Church, America's Freedom Church, I texted my pastor, Dr. now Senator Raphael G. Warnock, and he said, I'll pray with you, but you got to go to the doctor. So I did that with the encouragement of the Suicide Prevention Lifeline, my sister, my pastor. And I started on my antidepressants, going back to the medication conversation, because we have to also erase the stigma around medication. No, I don't think we should medicate everyone and our kids and our babies. But guess what? If you need that, if those chemical imbalances can't balance out with regular healthy coping mechanisms, then you may have to take medication. So I got on my antidepressants, which I like to call my happy pills, and I did the work. And I ended up, I kind of stopped taking them after 3 or 4 months, which is, again, you shouldn't do that. You should talk to your doctor and wean yourself off of them. I do know that now. But the point is, I got the help that I needed, and I still struggle, Karen. I'm 5, 6 years into doing this great work. I'm speaking all around the world, sharing my story, but I still have my moments. Yesterday, I did a big thing for Warner Media, talking to their Black employees around racial trauma and behavioral health. And I still, have my own issues of trauma when I see the police, right, as a person of color. So it's an everyday thing, but the difference is, and I said this last week on social media, my mom is in the late stages of Alzheimer's. I didn't know she was going to make it last week. The difference is I have the tools now. I know what to do, but I was in a really dark place when I thought I almost lost my mom last week. And so I had to take some time away. I started walking. I'm actually finding a better therapist because I liked my therapist, but I just think I need a little bit something more. So I'm walking the walk and not just talking the talk. So as you go through this, it may be something people that suffer from, whether it's PTSD, depression, suicidal ideation, you may never fully recover from it, but it is about recovery and resilience and behavioral health. So it is important, again, that you have the tools, that you know what you need to go through life every single day as we push through our emotional health and wellness journey.
Shanti, you never cease to amaze me. Because you are such an open book. And I know, just as we've talked about, Dr. Bird, it's social media, I think, hurting a lot of people because it looks like life is fabulous. Life is wonderful. Shanti's one of the only people I know that will tell you really what's going on in her life and share every bit of it. Stephanie, I'm going to move to you because as a journalist, you know how tough it can be to report on mental health issues, the challenges out there for us, not only in the journalistic sense, but also to give reporters, we need to give them some tips. You and I, we talked before we went on to this panel about things that, we as journalists need to be careful about when we're reporting some of these issues. So help any who may be out there. I know I sent this out to my entire newsroom and to people at Natus, so I'm hoping some of them are watching as well, because this is important information.
Yeah, I think, first of all, there's like the physical things that you can do, which is physical boundaries, obviously. Trying to work 8-hour days when you can. If you have to work a weekend, get that comp day, take all your vacation time. You need to be in direct communication with your editors about what you feel like you can or cannot take on. And if you can't take on something, or you're not in the space for it, or you'd rather do something else, say that to them and advocate for yourself. I think all of that is really, really important. I also think that there are internal boundaries that need to be set as well. And those are the more difficult ones. It's easier to say like, okay, and even though it's very difficult to block out these spaces in time and say like, I'm going to say no to this much, I'm going to say yes to this much. But it's a different thing to then not feel guilt about that, right? Especially when you're a journalist. And I think the mental boundaries that I created for myself that were really helpful were just accepting that I think when you're a journalist, you kind of believe that you're part of this noble profession and that what you do really matters. But the truth of the matter is not every one of your stories really matters that much. Like not every one of your stories is going to change the world or be like this make or break thing. Some of your stories are just going to be good enough. That's okay. That's everyone's career, right? I mean, Tom Brokaw didn't only have whatever Pulitzer winning stories. Sometimes he just reported on whatever. It's okay. Another thing is that I think that you have to disconnect your emotional validation, your self-worth from your work. that's really, really hard for journalists that take this so seriously. I think one part of it is just that it's a really competitive industry. So you see all of these other people around you working harder, working harder. I had a real hard ass boss because there's a lot of old school journalists in who are just going to be like, you have to dedicate your life to this or you're not taking this seriously enough. I think that I kept working harder and harder and harder, thinking that I was going to catch up, that there was a point at which I would catch up, or there was a point at which my boss would be like, okay, you're good enough now. He wasn't that kind of guy. It was never going to be good enough. And after I accepted that and I just realized like, you know, I need to take care of myself and what's right for me instead of trying to please you because you're kind of a jerk. Like my life got a lot better. And then, yeah, having also in terms of like getting outside validation besides work, those boundaries allowed me to have more time to develop other things. Like I got hobbies. I was better to my friends and family. I found ways that I am important to this world that don't revolve around radio stories. And so if I put out a crappy radio story or I'm not putting out any radio stories, I can still feel pretty good about myself. I can still say, hey, I'm a good friend. Or, you know, I volunteer in Forest Park a lot and pulling weeds and helping trees survive. And I can say, hey, I saved a tree's life today. That's not bad. And so I definitely think that having just a more healthy, balanced life is really important. I mean, it's great if you want to be super ambitious, especially in your early 20s or whatever, but I have to caution people who are just doing like the 70-hour work week. You might be on top of the world now, you might be kicking ass now. There will be a time at which you burn out and you will have more longevity in your career long term if you pace yourself rather than just like astronomically hitting the moon and then crashing. So those are my tips for journalists.
I hope some bosses are listening to this because those are very important tips. And, you know, people think, oh, I won't use all my vacation time or I won't take this time. You know, I want them to see how dedicated I am. Silly, not smart, because it affects your mental health when you are going. I mean, I can see as Shanti is as well. I mean, she'd call me about stories where she's going under the bridge to feed the homeless or paying for funerals for some of the victims in some of our stories that can't afford funerals. Those are the things that make you, know that you're doing something positive, you're making a difference, and it makes you feel good. Dr. Oury, I want to ask you about the CDC, and you guys are doing some things to reduce the stigma in all populations, especially among specific populations like people of color, who are hardest hit by this pandemic. How are you doing that?
Absolutely. And I wanted to just mention one thing about reporting too. There's a reporting on suicide.org website, which really talks about safe reporting and really, not glamorizing suicide like pictures of memorials, but focusing instead like on a school photo. Also not saying like successful suicide, but died by suicide. Some of those subtle terms really make a difference. And then focusing on warning signs and really the crisis line and how to seek help. When we released that vital signs 2 years ago, that same week, there were 2 high-profile celebrity suicides, but we had put out these safe reporting guidelines right beforehand, and the media did an excellent job of reporting in an appropriate way, and we saw increases in crisis lines. So I just wanted to add that. And certainly when we're looking at what to do with communities of color and decreasing stigma, I think conversations like this are really important. And Shanti, your story is amazing, and thank you for sharing. And I think it really goes to, people think that if somebody has a suicide attempt or suicidal ideations, it's inevitable that they'll die by suicide. And we know that 5% of people who have a serious suicide attempt go on to die by suicide. So by intervening, you can truly make that difference. And I think by sharing stories, talking about what resources are, that's one big way to really decrease the stigma. We're now funding communities to have community level approaches because we want it to be more than that individual level intervention. So things like social emotional learning in schools, like good behavior game, teaching conflict resolution, life skills is really important. After school programs, If you don't have that caring adult in your life, after school programs can link you with that role model. And then things like funding gatekeeper programs. So if you do see someone at risk for suicide, what do? These are things that we're trying to do in communities, particularly those with increased risk for suicide, to really increase those protective factors and get people the help they need and build community level resilience.
And can I just add quickly? And first, I want to apologize to Dr. Oury. I called you Deborah, so I'm sorry. I know that.
Oh, good. I go by that.
A doctorate degree, if you're a medical doctor or you've earned that degree, I want to make sure I honor, especially as women, it's hard enough for us. So I apologize. So what Dr. Oury was saying about words matter in terms of suicide language, it is really important. One of the things that I say now is completed suicide as opposed to committed, because just taking that a step further, when you say committed suicide, it kind of denotes a criminal act, right? And so most of the time when someone is having that suicidal ideation, they are not in their right frame of mind. So we want to make sure that we don't, criminalize suicide, right? That we're very thoughtful about it. And so another term could be completed.
Appreciate it. Thank you. And Dr. Bird, can you speak to us about Mrs. Carter's influence in the area of mental health? I know I've followed her, watched her as long as she's been here and at the Carter Center, discussed the importance of mental health all over the world. Was her work a personal influence for you?
Oh, most definitely. Having worked my whole career in Georgia, of course, you know who Mrs. Carter is and what she's done. She's worked tirelessly and focused for 50 years to decrease really discrimination that persons with mental illness experience because of the stigma. And she's also worked very tirelessly to address policies that cause barriers for people who access services. She's also really been a huge champion for persons with lived experience and bringing them to the table, encouraging them to tell their stories, and also is a big proponent of recovery and showing that with people with services and supports that are necessary, all people can recover and live lives with their own goals that they have for themselves. She's worked tirelessly, and a real area of passion for her is parity. People's eyes glaze over when we say parity, but that is basically the fact that we have federal legislation that says that our insurance, whether it be private or public, has to pay for mental health care, services, and supports on par with other physical illnesses. And our states, Georgia included, are not enforcing that federal legislation. So we're working really very hard to make sure that there's the administrative policy and legislation in place so that people don't continue to have to pay for these services out of pocket when they would never consider that if they had a broken arm or a diabetic or have diabetes and need care. So really work very hard on that. And then also we've talked a bit about prevention and early intervention. This is something near and dear to Mrs. Carter's heart, from prevention and intervention, early intervention for mental illness, but also for physical health. She's been a proponent of vaccinations for years for children. So really, we hope that although we need to act quickly with a community response to this pandemic and this second pandemic of mental health, we've also got to continue to put prevention and early intervention public health responses in place, some like I've mentioned, and that Dr. Oury mentioned and others, social and emotional learning in all of our schools, mental health first aid, support clubs for kids, silence the shame, these kinds of things need to be universal in our communities.
And what a perfect time to move on and hear from the wonderful and famed Mrs. Rosalind Carter herself. She has a message for us. Couldn't join us, but let's listen in.
I've worked on mental health issues since My husband was governor of Georgia, which is a very long time. I worked on stigma and tried to overcome stigma because it holds back progress in the field. People don't get help when they need it because of stigma. And when we came home from the White House, I knew I wanted to continue that work. I'm really proud of it. We have a great program here at the Carter Center. To me, one of the best things that's happened in my mental health work is a program to educate journalists about mental health issues. We call it Mental Health Fellowships for Journalists. I want my mental health work to carry on, even after there is no more stigma, which I'm not sure will come in my lifetime, but I hope it will. But even after we don't have stigma to work on, there's always going to have to be a lobby to get the services that we need. And I think it will still be very important for the mental health community to come together the way they do now. We have a great opportunity to change things forever for everyone with mental illness. The solutions are truly within our reach. We can overcome stigma, and we can make services available to all who need them and offer every individual the chance to create a happy and fulfilling future.
Love that, love that, love that. She's so fabulous.
Hero.
Yes, she is. And she was ahead of this game before anybody else knew really what to do. I remember going to some of her meetings, going to those workshops back, 80s, 90s, I'm dating myself, but she was always ahead of the game. And I appreciate and applaud her and the work being done at the Carter Center for that. We've got audience questions, I believe. So we want to take some of those?
Yeah. I'll jump in with a question from the audience that was actually sent to us on email. It's directed at Dr. Howery, and it's about kids going back to school after being out of school, kind of what teachers can expect and what teachers should look out for if young children. I know we talk a lot about adolescents and 20s and adults, but in younger children, if there's things that teachers need to look out for. This was a question from a teacher.
So, teachers are so important because they recognize, signs of like child abuse and neglect. And we know that they were very frontline providers and we actually saw a decrease initially of reporters because kids weren't in school. So I think for, teachers just looking for, any signs of neglect or issues, but I'm really positive, and I've got a kid who is back in school in person now. And I can tell you how wonderful it has been for her. I think just having those relations with teachers is really important, that connectedness, and for teachers to understand we should treat every child, in my mind, with trauma-informed care. We do that with a lot of, we've given funding for groups to look at this for those that have been exposed to drugs or substances in the home. But in my mind, every child should be treated not with, what have they done wrong, but how can we help them? We don't know what goes on in their home. So if somebody comes in with late homework or not, wearing the same clothes from yesterday, realize there might be going something on in their home. Don't point the blame at the child. Talk with them, in a very open and concerned way, and be that safe person for that child. I think kids will be excited to come back to school. We don't know masks or no masks yet, but my child wears a mask in school and is just happy to be there. As children are resilient. So I'm not really concerned about kids. I think it's more about that teachers recognizing what's going on in kids' lives and that kids may have experienced a loss and making sure we're connecting kids to the resources that they need.
Perfect. And we have one for Stephanie here. Stephanie, what has it been like writing a book during a pandemic, especially since a lot of your writing has been about mental health? Can you tell us a little bit about that?
I liked it. I definitely think that everybody working from home was really, really helpful for me. Because I was able to take the space that I needed. And everybody, it seemed like, had these sort of not 8-hour 9 to 5 days anymore. People were kind of working when they could, and then they would go help out their kids, or they would go cook, or they would go on a walk, and then they'd come back to it, and it would be sort of jumbled. And so that was definitely what my experience was writing a book, because I don't think you can write about trauma for 8 hours straight. You can for me, writing about trauma for 4 hours max, that was a really, really good day. That sort of jumbled up schedule, that being normalized, really made me feel still really productive and good, I think, about that experience, and being able to take a lot of nice mental health breaks, and eat a snack if I wasn't feeling well, or watch an episode of Avatar, The Last Airbender, if I needed to, just get back into a peaceful groove. So yeah.
Very good.
That's good. That's good points. Now this next, I see a question that really moves us right into what we need to do before we leave. An HR professional should like to access any mental wellness, mental health resources that are out there. And with that, let's go right to Ms. Shanti Das. Up, you're muted.
Sorry about that. Do we have a slide that we're going to put up, Christy? But I do have some that I can mention off the top. The National Suicide Prevention Lifeline, as mentioned, is 1-800-273-TALK. Also, if you're in crisis, there is a wonderful organization called the Crisis Text Line Organization. And it's not in place of therapy, but it is 24 hours a day, 7 days a week. It's totally confidential. You can text the word silence to 741-741 and be immediately connected to a trained crisis counselor, and then they can in turn help you find a therapist in your area. Also, SAMHSA's treatment locator is 1-800-662-4357. The disaster distress helpline is 1-800-985-5990. The Veterans Crisis Line is 1-800-273-TALK, and then you press the number 1, or you can text to 838255. And then the Trevor Project is a great organization for the LGBTQ plus community. And of course, silencetheshame.com. We have a resource tab that you can tap right into. And it's so many other incredible organizations like that. And then also, I don't have the number handy, but the Georgia Crisis Access Line for those living in the state of Georgia is another wonderful resource to help families. I know there was also a question around helping caregivers and family members. And I want to also point out NAMI, which is the National Alliance on Mental Illness. We have a partnership with NAMI. They have local chapters in all major cities. And so they have a lot of other programs around parents and caregivers. So go to NAMI.org for that. Also, the National Advocacy, and there are several other advocacy professional organizations, the American Psychiatric Association, the Anxiety and Depression Association of America, Black Emotional and Mental Health Collective, BEAM, that is a great organization that we've done some work with. The Depression and Bipolar Support Alliance, Mental Health America, and they do have a Mental Health America Georgia office. And again, NAMI, which I mentioned. And the federal agencies, as you can see, Substance Abuse and Mental Health Services Administration, which is also known as SAMHSA, the National Institute of Mental Health, and the Center for Disease Control and Prevention, which Dr. Auer is representing today. So check out their websites. There's a lot of great information out there. And then, you know, if you, within your own organizations that you work for, check with your EAP, Employee Assistant Programs, to find out what mental health resources might be there for you. And then again, the external ones that we just reviewed.
And you don't have to worry if you couldn't write all that down, because guess what? We're going to have them available for you, right?
That's right. Thank you, Karen. And I wanted to apologize. We did have an audio glitch at the beginning of the program. We did share in the chat, if you're still watching, the complete video of Dr. Rochelle Walensky's remarks. I think we lost audio on that for the first minute or so. So the complete video of her remarks is now up on our YouTube, and the link is in the chat if you're on the Zoom. We will follow up with an email with that link, as well as links to the resources that we just showed. So look for that in your follow-up email from Zoom. Thank you to our wonderful panel. This was a great discussion today. Thanks, Karen, for being our moderator. Thank you to Dr. Deborah Howery from the CDC for being here, to Shanti Das for being here, journalist Stephanie Fu, and Dr. Eve Bird from the Carter Center. We want to thank our friends at the Carter Center. You can visit cartercenter.org and learn more about their mental health program. And we also thank our sponsor today, AIDS Healthcare Foundation. Thank you to them for caring about mental wellness and wanting to be part of this event. Thank you everyone for viewing this. You may visit the Atlanta Press Club's website, atlantapressclub.org, to see more of our videos, and our YouTube page as well. You can just Google it and find our YouTube videos of all our events. Please go to our website if you would like to become a member, to donate. We'd love to have you. Thanks again, everyone. Great.
Can I say one thing, Christy?
Sure, absolutely.
My book is available, Silencing My Shame, at my website, which is Shanti Das, SHANTIDAS.biz. You can follow me on Instagram at ShantiDas404, or please follow our organization at Silence the Shame. Thank you.
Great. Thank you so much. Thanks to everyone who were in the audience today. Thanks for viewing. Again, we will have the complete remarks from Dr. Walensky on YouTube, so click the link in the chat for that. Thank you, everybody.
Thank you, Atlanta Press Club.
Thank you.
Thanks, Amara.